Hello and welcome to this episode of The Heartbeat, the NHS North East and North Cumbria Integrated Care Board's official podcast channel, giving you the latest health news, stories and innovations from across the region. Today's episode has been created in support of World Immunisation Week, which happens on the 24th of April. And today we're diving into a crucial topic, vaccinations. What are they good for? Joining me here today is Dr. Catherine Monaghan, Medical Director for the North East and North Cumbria region. And together we'll explore the ins and outs of vaccinations, their importance, and dispel any myths surrounding them. So I'd kind of like to start by you telling us about your career journey. So how did you get to where you are today? What are your particular interests and work focuses?
Absolutely. So I was born and raised in beautiful sunny Thornaby, just about 5 miles from where we are here. I've always known I wanted to be a doctor, so worked very hard at school, went to local comprehensive and a local sixth form college, and then got into Leeds Medical School, where I spent 5 years training. Did a couple of years as a very junior doctor in local trusts in Leeds, and then the lure of Teesside was too great for me, so I came back and kind of did my relatively junior medical training. Decided I'd had enough of the NHS for a while, so went to Australia for a year and a half, worked over there, came back, and then got a training post in what we call the North East Deanery, rotating around the hospitals in the North East, training in general and respiratory medicine. Qualified as a consultant in 2013 because I had 3 children. During that time, 3 teenage daughters, God help me. So took my time training and qualified as a consultant in 2013. Practiced at North Tees for 10 years as a consultant in acute and respiratory medicine. And then fairly recently, an opportunity came up to move into the ICB, taking a bit more of a strategic role and a look across systems, which I applied for and got. So that's where I am now. My clinical interests are around acute medicine, so where patients go when they come in through the front door. I like the challenge and the variety of all of that. And even though I'm a medical director now, I still practice clinically because I think that's really important. Within my ICB role, I'm the lead for vaccinations, which we're talking about today, respiratory, cancer. I'm very interested in how primary and secondary care work better and differently together. And I'm also got a real interest in hospital home services. So how do we take acute care into patients' own homes to give them the care they need without them having to come into hospital unless they have to?
Fantastic. It's a very impressive resume then.
I'm not sure about that, but yeah, that's where we are.
Brilliant. Well, so I'd love to sort of dive into sort of your experience with vaccinations and everything. So I guess we always hear medical experts talk about the importance of vaccines. But perhaps you could start by telling us why are vaccines so important in today's society?
So the best way to sum it up probably is with a good one-liner: vaccines save lives. And then I can kind of unpack that a little bit. So vaccines are safe, they're effective, and best of all, they're free on the NHS. So in terms of the safety profile of vaccines, they've been around for a very, very long time. These vaccinations are very heavily researched and clear, good quality safety trials are done, so we know that they're safe. You can get side effects, which I think we can probably explore a bit later, but generally they are safe. They're effective. So what I mean by that is they significantly reduce the chance of you becoming seriously unwell or dying from illnesses. So if we go back, many years ago, people died of smallpox. We don't have smallpox anymore, and that's because of the vaccination programme. Polio, there was a big polio pandemic, people in iron lungs for long periods of time. We've eradicated polio. That's because of vaccinations. If you do get the illness, then it significantly reduces the chance of you becoming seriously unwell or dying with it across most of the vaccinations. That's a bit of a broad statement. There's really good evidence for all these vaccines that they seriously reduce your risk of becoming seriously unwell. And last, and I guess really best of all, they're free on the NHS.
With a growing list of new vaccinations that are coming out all the time, I guess it's easy for people to become overwhelmed with just how many there are out there. But could you maybe tell us what vaccines should we be getting throughout our lifetime, or perhaps where can people go to find out that information?
Yeah, so you're completely right. As part of the preparation for this podcast, I'd done a bit of a research into this as to vaccination schedule, and it's really quite complicated. The NHS website would be the one that I would recommend, but we could broadly split it up into vaccinations that you have as a baby. So I have a 6-in-1 vaccine: diphtheria, tetanus, polio, those childhood illnesses. Meningitis is in there as well, that babies would get. Children, you would be looking at meningitis, flu from the ages 2 to 15. So they kind of set people up, if you like, for to get rid of the common bad illnesses that we used to see a lot of. And then as you move into adults, we'd be looking at flu for 65 or over, COVID vaccines for certain populations. So we don't offer routine COVID for everybody anymore. Times have moved on, and they're very, very targeted towards the people that we know are at the most risk. Shingles is a relatively new vaccine, and there's more and more being developed all the time. But for people that want more details of the very specifics, I would recommend the NHS website. It gives a very detailed, clear schedule.
So NHS website is your go-to resource for
Absolutely.
all things vaccines.
Yeah.
Perfect. So perhaps then leaning into the topic of COVID. So I personally remember going to get my first COVID vaccine and feeling quite nervous about it at the time. And I'm sure I probably won't be the only one from then. I guess, why do you think people might express certain hesitancy towards getting new vaccinations or vaccinations in general?
I think that there's quite a lot of things out there on social media which aren't always true. People hear horror stories, and yes, certainly with the COVID vaccine in the early days, there were some issues, but generally these vaccines are really, really safe, and you may get some side effects afterwards, and I think that puts people off. There's myths around like, well, if you get the flu vaccine and I got flu a few days later, it's highly unlikely that would be what we would define as being flu. You don't catch the illness from the vaccine. That's not how they work. So I think there's a lot of rumours, a lot of misconceptions out there, and we really just want to debunk them. These vaccines are safe and effective. We wouldn't offer them to people if wasn't what we truly believed.
So as medical professionals, having that rapport and trust with patients, for example, is incredibly important. But from your perspective, it's a bit of an open question, this one, but from your perspective, how can we build trust with patients who are perhaps hesitant about vaccinations?
So I think that approach really would very much depend on the patient, as we would call them in healthcare, or the person. It depends on what their reasons for hesitancy are. So some people need the data. So there's sources of data. The World Health Organization would be another one I would recommend. If you want to understand the data and what that looks like, then that can be really useful. Some patients just trust the healthcare professionals. So I've had patients who I've been looking after from a respiratory perspective for a long time, and I would always say to them, I really want you to have this vaccine. I don't like the thought of you getting flu or getting pneumonia, because I would worry that it would make you very, very unwell. And there's nothing I would be able to tell you that would make me concerned that you would become unwell from the vaccine. So sometimes that's enough. I think we could do more with trusted voices in certain communities. So the evidence is good for most people that, broadly speaking, they still trust healthcare professionals, and we are the most trusted group. But some people don't, for various reasons, personal experience, whatever. And, trusted voices within communities, champions for these things, who have had the vaccines themselves and who believe in them. Not Facebook. Please, not Facebook.
Yes, absolutely. Yes, I think I'm sure many would agree with you there. So, and then obviously, childhood vaccines are obviously very important now in today's society and everything. And what would you say to people, particularly parents maybe, who are nervous about having their children vaccinated? And what would what kind of reassurance or advice would you give to them?
Absolutely. So you can always discuss it with your GP if you're concerned, or your health visitor. Again, there's a lot of really great information out there. So there's a really good video. I haven't got shares in the NHS website. I just need to be clear about that. But there's a very good video on that about what specific questions and advice people can give parents. The thing that I would say, MMR is very topical at the moment. We generally have reasonable coverage in our area, but we have pockets of low coverage, and we've had a measles outbreak, and that's a real concern. These illnesses can be very, very serious. The risk of getting measles in an unvaccinated child, if you come into contact, is very high, and it can be a very serious illness. At the worst case scenario, fatal, and it can leave people with life-changing complications from something that's very preventable by a vaccine of which we know it's safe and we know it's effective. I think it's difficult to say any more than that, really, other than to just absolutely assure people these vaccines have been around for a long time. Measles, mumps, rubella, MMR does not cause autism. That link has been deep. It's been proved to be incorrect. And I just want to assure people that there aren't these links. It's the right thing to do to protect your children. And what mum, like I said already, God help me, I've got 3 girls. The thought of them getting something that I could have intervened and stopped, it just leaves me feeling very uncomfortable. So as a mother, if nothing else, please get your children vaccinated.
Side effects, obviously, are a normal part of vaccination. And many will feel that sometimes the side effects might even be worse than potentially getting the illness itself. Are there any common side effects that people might experience when getting a vaccination? And perhaps how might they be able to treat this in the comfort of their own home, for example?
Absolutely. So sore arm, sore leg at the site of the immunisation. You can get a temperature, high temperature, not necessarily very, very high, but what we would describe as being a low-grade high temperature. So it's up a little bit, which in itself makes you feel a bit unwell. And we would recommend, I guess, what we would call common sense precautions. So if you've got a temperature, we recommend drink plenty of fluid. You can take paracetamol. Don't overdose on paracetamol. So just a little bit of a guidance around that. No more than 2 tablets 4 times a day. Don't take any more than that. In adults, you can take anti-inflammatories like ibuprofen. That can help. Not in children. There's a risk there. But I think just common sense precautions. Do they make you feel worse than the disease? No. You may get a sore arm. I'm going back to measles. It's not like having measles. You may feel a bit uncomfortable after the flu, a bit of a sore arm, a bit of a temperature. Just speaking from bitter experience as somebody who's had flu, it's not the same. It's not the same thing. And proper flu is a horrible disease, very, very serious potentially in older people. And every year we see people die from flu. I've never seen anybody, have that strong a reaction to a flu vaccine.
Speaking from lived experience or your own flu experience, is that
horrible?
Yeah. Okay. Well, now I'm sure you'll be very familiar with the myths and misconceptions that float around on social media regarding vaccinations. Are there any sort of common misconceptions that you hear about regularly, and what sort of response would you give to those misconceptions?
Yeah, so there's quite a lot, isn't there? Flu vaccine causes flu. No, it doesn't. It doesn't give you flu. That's not possible. It will make you feel a little bit under the weather. As we've already said, that's not the same as having flu. So the vaccines can't give you the illness. One thing I've heard about, which you do get people saying quite a lot, is that some of these illnesses would have died out anyway. That's absolutely not true, and the data is very clear around that. So we're going back many years ago. Living conditions weren't as great. People weren't as well nourished. People lived, bigger families in more close contact. Diseases did spread much more quickly. And as those conditions, in the broader sense, changed and improved, rates of illness did go down. But there's a clear timeline between introductions of vaccines and diseases dropping. So vaccines, the myth that vaccines don't prevent, haven't impacted on this is absolutely not true. There's myths around them containing mercury. It's not true. They don't. And again, just to give people some guidance as to where they might go, the World Health Organization, so WHO, as it's known, if you Google World Health Organization, it'll take you to their website, and they've got a fantastic list of common myths around vaccines, and then there's scientific evidence underneath them, which I would recommend people have a look at, because it will debunk the vast majority of the nonsense. Facebook isn't the only social media site. It will debunk a lot of the untruths that are actually harmful that are out there on social media.
Absolutely. And obviously, the rise of things like fake news and these kind of clickbait headlines on social media obviously draws a lot of people in. But I guess, so from your perspective, it's make sure that the information you're consuming, whether it is on social media, is coming from reliable sources, the NHS, the World Health Organization.
Yeah. Or gov.co.uk, they've got a really good piece on it as well. So if you Google government advice on vaccines, that'll take you to gov.uk, and I would recommend that as well. You need to be a bit careful about certain websites and not recommending them. But just to give you an idea, Wikipedia, for example, people can submit their own things onto that, so you do need to be careful. Whereas if it's the NHS, gov.uk or the World Health Organization, the information on there will be valid, accurate and up to date, because it goes through so many checks before it gets put out there. And that would be what I would recommend you with sources. And this podcast, obviously, as well. Obviously.
Oh, well, so we're very close to wrapping up, Dr. Monaghan, but I guess I wanted to throw this one in at the end. So it is, with vaccines and the incredible developments that are happening all the time, I mean, what do you see for the future of vaccinations? Where could we be in the next, 20 or 50 years? What could be curable?
I think you're right. It's potentially very, very exciting. So to make it, I guess, more tangible, human papillomavirus. So it's it's one of the main risk factors for cervical cancer in women. And with the advent of the HPV virus, that will potentially be completely and utterly eradicated in 20, 30 years' time. It does take time for these things to work through the system, but vaccines, we could potentially be in a situation where we will be able to prevent rather than cure a huge amount of disease, and that is a very, very exciting opportunity. It does lead me to the question as to what will we all die from, but actually that's quite a good problem to have, and there's scientific work going on all the time looking at new opportunities, vaccines for cancers, vaccines for lots and lots of illnesses. There's constant work going on, which is very, very exciting and could really change the landscape, I guess, of healthcare as we move forward. I think I'll probably be dead by the time a lot of it comes to fruition, but not dead from flu or measles, which is the point of vaccinations.
Also, very exciting things on the horizon then.
Very much so, yeah.
So to answer our original question, vaccines, what are they good for? Turns out quite a lot then.
Exactly the opposite of absolutely nothing, which we sang before we started recording. They are good for huge amounts of things, safe, effective, free on the NHS, and they save lives.
Brilliant. Dr. Catherine Monaghan, thank you so much for joining us and sharing your insight on vaccinations. It's been a pleasure to have you.
Pleasure.